Confluent and reticulated papillomatosis was first discovered by Henry Goudreau and Alexander Carteau. It was first discovered in 1927 by the use of electron microscopy. Confluent and reticulated papillomatosis was then named after the two scientists that discovered it, which was then later called Goudreau and Carteau syndrome. Confluent and reticulated papillomatosis is disordered keratinization, which is presented as dark spots on the skin, which are located in areas such as axillary, trunk, and nape. Confluent and reticulated papillomatosis is sweat-induced, which means areas that you sweat the most, such as your armpits, your trunk, and the back of your neck, will be the most affected areas. It has been proven that only 0.02% of the population is diagnosed with this disease, so it is very rare, and it is most common in women in ages 8 to 32 years of age. The images shown here are areas such as the axillary and nape, which are areas that are affected the most by the overproduction of keratin. Henry Goudreau and Alexander Carteau discovered confluent and reticulated papillomatosis by taking a skin biopsy of a patient. The sample of skin was then used in a gram stain, which presented the different types of bacteria in the sample. The sample was then confirmed to be gram positive, which then later confirmed their diagnosis. Confluent and reticulated papillomatosis is confirmed to be the overproduction of keratin, which is presented here. As of right now, there is no cure for confluent and reticulated papillomatosis, but there are other treatment options that will reduce the side effects, such as minocycline, antifungals, topical ointments, and obesity can be a causative factor of confluent and reticulated papillomatosis, so weight loss can also be an option. Minocycline is one of the most popular ways to treat confluent and reticulated papillomatosis. This model shows keratin binding to the minocycline molecule. Confluent and reticulated papillomatosis affects myself because I was diagnosed in March of 2014. It is frustrating because there is no cure, and I find myself being insecure when people ask me what are these dark spots on my body.